Welcome to Talking Health Tech with Macadamian, where we explore the intersection of technology and healthcare. We've worked with many innovative companies to design and develop digital products that improve people's health, and we want to share all that we can to help people build better products. So let's get to today's episode.
So today on our show, we have a very special guest, our VP of Customer Solutions, Timon LeDain. Timon, thank you so much for joining me.
It's my pleasure, Ali.
So let's, dive right in. We are talking about a interesting subject matter, telehealth. It's a burgeoning industry. I was looking at a recent study that said that telehealth is going to go from being worth $83 billion in 2020 to $319 billion in 2025. Now, before we dive into that, what is telehealth?
So I've been personally involved in telehealth since the early 2000s. And telehealth is essentially the ability to deliver care through technology. Typically, it's associated with the ability to have a clinical exchange between a patient and a clinician over what we're using for this podcast, which is a video meeting. But it can also be by phone. It can also include, remote health monitoring that's supported through a virtual coach. So it's getting quite broad, but it's typically associated as the delivery of care at a distance, as opposed to the traditional face-to-face care that we're so used to with our GPs.
Yeah, that's a great definition of it. So now, why are we seeing such exponential growth around telehealth?
I have to say it's one of the side benefits, I guess, of this pandemic was that it quickly became the only way in many cases for care to be delivered. And as a result, some of the longstanding barriers to telehealth adoption from the past were finally addressed by the groups that pay for care by essentially ensuring that it could be reimbursed, so that all of a sudden these clinicians or specialists could actually be paid for delivering the services that they traditionally, in many cases exclusively, delivered through a face-to-face visit.
Yeah, so that's a good point you bring up. So essentially, there was a time where these digital means of communicating with a patient wouldn't necessarily mean a paycheck for, say, for example, a doctor. But now that has changed.
Absolutely correct. So the technologies that even today are being deployed for telehealth existed and were being introduced in the early 2000s. And the biggest challenge to adoption was really never technology so much as the reimbursement models that, yes, they couldn't be adopted because no one would pay for care delivered via that means. And it was really used more for delivering care to remote communities where the cost of travel was excessive, or in particular use cases such as telephone triage, as some of the states and provinces have done to address people going into emergency rooms when they really may not need to. So providing kind of patient education and decision support to allow them to make an educated decision as to whether or not they really need that face-to-face care. But otherwise, the traditional model of care was largely, the way we've been delivering it for decades.
That's interesting. I feel like if there's any kind of silver lining to this pandemic, it's the fact that it helped us develop this business model around using telehealth, making it more functional and in the healthcare space as we know it. But you brought this up. Telehealth has been around. It was here prior to the pandemic. The pandemic just sort of sped up the need for telehealth. Tell us like a few more reasons why you feel like how the pandemic has made telehealth even more important.
Yeah, so I think that telehealth, as I mentioned, traditionally has been used for maybe a narrower subset of use cases, and people need to receive healthcare services. They can't stop, and we see the impact on on patients and on the healthcare system overall when care is for whatever reason being held up or delayed as a result of a situation such as we're facing with the pandemic. And so there was essentially across the world, a single catalyst for figuring out, both from a technical perspective, from a clinical workflow perspective, and from a reimbursement model, how we could remove these barriers because it was essentially our only option, right? And so it just really aligned everyone on a common goal, which is how do we continue to receive the care we need and deliver the care that our patients need for as long as we're living in this situation.
And you brought up the fact that now there's a potential for now telehealth to become a bit more ubiquitous. We're going to see it not just, for example, in remote communities. It's going to be used across urban centers across the entire country. Are you noticing, or I guess I should probably phrase the question like, how are you finding telehealth is making healthcare more equitable? Is it making healthcare more equitable, first of all, and if so, how?
Yeah, that's a great question. I think a lot of people are quickly getting comfortable with the benefits of telehealth that they may not have before. I mean, I was just talking to a colleague recently who asked me, are we ever going to go to the grocery store anymore now that we can kind of order by phone or order online? And I think telehealth is similar, right? It's people realize, wow, it's so convenient. Like opening an app to make a request as I'm sitting in my pajamas on a Saturday morning to determine how I treat a certain ailment, is very convenient. And having your family doctor say, we're going to meet with you by phone at 2 p.m. and actually having that phone call happen at 2 p.m. on the dot, whereas you remembered waiting for 30 to 40, 45, 60 minutes, sometimes in that waiting room to see them, right? So all of a sudden you realize, wow, I got what I needed out of the interaction. Um, you know, I sorted out the healthcare problem, and yet here was all these side benefits. I never had to leave my home. It happened, on time, and you know, I was none, no worse for wear as a result.
Yeah, because when I was thinking about this question, I thought a bit about individuals who might not have access to, I don't know, a vehicle, or who might have mobility challenges, and they can sort of, get access to healthcare from the comfort of their own couch. So, are we seeing that happen more and more, thanks to the growth of telehealth?
Absolutely. And they're seeing this change across that traditional provider model where, your primary interaction with the healthcare system forever was, through your family doctor. And now we're seeing that model changing with, service providers providing kind of in-app clinical support through just simple messaging to kind of video visits from your phone or your desktop. We're seeing that model shifting, and people's preferences as a result are shifting to that. And that's why the adoption of telehealth via phone has been such a huge success, is they've actually seen that it diverts people from going to the emergency. So when you realize that you can safely treat a fever of 104 with your that your child has, because they've only had it for 5 hours, and that's not a reason to go to the emerge, but in fact can be treated through products you can get from your pharmacy, then it gives the parent the reassurance that, well, I'm going to wait a day or two, make sure the fever subsides, and I won't go as I plan to drive the kid to the emergency room because I've received this advice from a nurse on my phone. And it's those types of exchanges that people are embracing and realizing, wow, there's an alternative that gets me what I need, but is clearly more convenient and ultimately saves a lot of costs to the system overall.
Yeah, I'm finding that you brought it up. It's more convenient. It's making healthcare in general a bit more efficient as well. Um, what other problems is telehealth solving for us?
So in the pilot that we did back in the early 2000s, the problem we were looking to solve is the time that these nurses were spending in their cars driving between the homes of chronically ill patients to be able to take their vital signs and meet with them and report on their care and their progress. And so, the solution with telecare, with telehealth, was to be able to have those nurses deliver it from a workstation so that they could see more patients, avoid all that windscreen time, and yet deliver the same care. And what's interesting is that we were so focused on what the patient was going to lose, that face-to-face contact time. And we thought, it'll be interesting when we did the wrap up to see what were the impacts to the patient of adopting this new technology. And we were actually surprised by what we heard because, in many cases, patients would spend the morning cleaning their home to make sure it was presentable when their nurse showed up. And when the nurse said, "I'll be there Thursday morning," it could be any time between 8 a.m. and noon. And so, in many cases, they had a busy social life and they basically had to, you know, sit at home to make sure they were there for their nurse. Whereas they said, when my appointment was booked at 9:30, I knew that was, I'd be done by 10 and could head out of the house. And I was still able to kind of show my nurse my new cat or, exchange recipes. So there was still over the technology, the ability to have those personal connections that are so important in those face-to-face meetings. And so we're seeing, an amplification of the benefits for which telehealth was developed and a minimizing of some of the concerns that we originally saw with patients and clinicians adopting this technology that really have actually kind of benefits that outweigh the disbenefits that are going to ultimately drive broad adoption.
Yeah, you brought up the example of these individuals showing their pets to these nurses. I think that's kind of key because you want to keep the exchange as human centered as possible, and so there is potential for that in telehealth.
Yeah, absolutely. Yeah, I mean, there's going to always be a bit of a barrier to the distance, which is why it's so effective because it prevents COVID spread. But it's amazing how much you still get out of a video visit and audio visit when you're seeing the individual. There's still quite a bit of the connection, personal connection that can happen in that clinician's office or in that home visit that you're losing through the technology.
Right. This question just popped up in my mind now. Is there anything that telehealth cannot address or cannot solve in the realm of healthcare?
That's a great question, and the biggest one was seen as vital sign capture, right? You think of the traditional clinical visit. There's the manual arm cuff and the stethoscope for heart lung sounds, blood oxygen, and so to a greater degree, some of these things have been addressed. So now you can go to your pharmacy and buy a $40 blood pressure cuff, and so the cost of vital sign monitoring devices that patients can just buy for their own use is going down, and even FDA approved and clinical grade devices are quite affordable, and so the clinician can actually just ask them, have you taken your blood pressure today? Can you do it for me? Right, and there's devices now allow you to hold a stethoscope head to your chest as directed by a clinician so that they through a headset can actually listen to those heart and lung sounds. So the technology from a medical device side is growing so that these devices are now operative over a video visit where they might have traditionally been designed just for face-to-face visits. And we're actually interacting with a number of medical device manufacturers who are coming to us just for that purpose, to say, how do I make this device that was really designed for a clinician's visiting room or office? How do I make this now operable via telehealth solutions?
Yeah, no, it's interesting because it's in a way you're also getting the patient to be a bit more. There's a sense of empowerment when you're doing these things on your own, checking your own blood pressure, obviously under the guidance of a medical practitioner. but there's an element of empowerment there. Do you, we started this conversation with the influx of money that's going into telehealth. It's a growing space. When do you think telehealth will become the norm in the healthcare space? Are we there yet?
I mean, the norm sort of implies that it will displace kind of traditional face-to-face care, and I'm not sure that will ever get there. But I think what we're seeing is an acceptance and a desire to leverage telehealth when um, we feel like the benefits outweigh the disbenefits, right? When there's, when the concern we have could easily be done over a telehealth visit. I mean, a good for anyone who's been concerned with a mole on their skin, with the quality of smartphone cameras today, there's really no reason to see a dermatologist or even your family physician to determine, whether you should be concerned about a mole. You could literally take a very high resolution image of it with any smartphone you have, email it to your physician, and get a response back, right? So I think what we'll see is this change that there's going to absolutely be a core set of things that you want to see a specialist in person for. But we're going to see a growing number of concerns that are much more effectively treated through a telehealth visit, or even asynchronously through an exchange of emails. And I think we're going to see that type of adoption grow as we look for overall ways of making the healthcare system more cost effective, while also delivering the best value to the patients and the best level of care.
Right. And so this is, I guess, my sort of last question, and it's around that norm of what telehealth would look like. So from what I gather, it will be a hybrid almost. It will be an environment where we'll have this, digital communication going on in terms of getting access to healthcare, but individuals will also have the option of going in person to get a health check.
Absolutely. And you mentioned, where will it really play a defining role? I mean, it shocks me to hear that, colleagues in parts of the world where they live, waiting years to find a family physician, right? So there's many, many people for whom they don't have a currently kind of a trusted healthcare source that within a reasonable time they can actually book an appointment with. And that, I think, is going to be where telehealth is going to play a huge role, because that will bridge the gap between those that for whom care is readily accessible, affordable care is readily accessible, and those for whom it isn't. And so they'll be able to visit with a clinician via telehealth solution, because that clinician, that specialist, can be pretty much anywhere in the world because of the technology. And so it bridges the gap in those locales where you don't have access to that care.
Yeah, and that brings me back to my earlier point about, making healthcare a bit more equitable. That was a very fascinating conversation, Timon. You brought some valuable insights. I appreciate your time in talking to me.
My pleasure. Thanks a lot, Ali.